All right, today we are talking about Kybella, and we're going to actually do an injection of Kybella, which is for what's called submental fat, or what we like to commonly refer to as double chin. So as you can see, there's a little bit of excessive fat, and she wants to get rid of that, and she wants to do it painless, easily, and quickly. And that's what we're going to do today with Kybella. The active ingredient in Kybella is actually deoxycholine, which is made within our own body and allows us to absorb fat in our gut. In this case, we're going to inject it, and the fat cells in this area are going to be greedily taking this in, and what they will do is they will basically not be able to sustain, and they'll just lyse, or that's a fancy word for saying explode, and basically they're just going to be carried off with a normal process. So here we're going to start, and we're going to ice. Let's do the right side of her neck to begin. And basically, some of the things you can see is you can see markings on the skin. We don't typically mark just because I've been doing this for so long that I know exactly how far we're supposed to space it. And that's what we're going to space it, is if you were marking it, that's how we're going to space it. Then we're going to ice again. And she's really feeling minimal discomfort right now. When you inject into a fatty area, you do feel the little stick of the needle, but you don't feel pain with the actual injection. Now, pretty quickly, she'll have a little bit of swelling going on with this product, and that's very, very normal. She may even have some overlying redness or pinkness to the skin itself, but that's a sign that it's doing what it's supposed to do. It's inflaming those fat cells, it's causing them to lyse or explode, and then they're just carried away in normal bodily processes. We're going to take it up. We want to actually see the definition of her jawline more clearly, and that's what we're going to see. This is actually her second injection, and she's already seen a difference after just the first injection. And I like this product a lot because you really can customize it based on the patient's jawline, the fat distribution, etc. So very customizable, and nothing is that quick. That's halfway done. We've done one of the 2 syringes. Now I'm going to stay on this side, and I'm just going to have Patty just turn her head slightly to me, and that way we can still allow people to visualize what we're doing. Still doing okay, Patty?
Yeah.
All right. As with any injection, there's possibility of bleeding. All bleeding stops eventually, I like to say, but honestly it's minimal. And if anything, it would cause a little bit of temporary bruisability that would typically resolve within just a couple of days.